Okay, then the financing proportion, the proposals is what we are most worried about because we don't know where the money is going to go and how it's going to come down. Okay, and that's the one that you need to really think about it properly. And yes, the Taknak group, the one who doesn't like this group, by a different doctor group and another NGO, feel that if we go ahead with this, it's only going to worsen the healthcare for most of the people in this country, which we share to some degree, not entirely, all right? But I think there's a genuine fear that you are asked to, see, right now, if you don't have money, you can always go to the public hospitals right now, spend at 1 ringgit, 30 ringgit to see a specialist, and the second time is only 5, I think, and you still can see someone. Yes, there will be some wait times, you still get a chance to see. Later on, when it becomes a bit corporatized, when it becomes integrated, your choice will be severely limited, and you are paying on top of it. And if you want to see someone else because you're not satisfied, you pay right on top again. And although they say that it's not true that you can only see your GP 6 times a year, the amount of money that they're allocating is only for so much, which is what you're told the capitation fee. I'm going to give you, for your 3,000 patients, each one will get, for that year, it's actually per year, we're going to give you roughly, the number that they're arguing with is around 300 ringgit per year, per household or per person under your team. Yes. There's a big fight. They were thinking of 150 as under the TWG. So how would the GP receive this? Is to treat you with the cheapest possible medications or don't give it to you at all, and then ask you to go and get it from the pharmacy. And they haven't addressed this. The medicines most likely will be taken out from the GP and given to the pharmacy, and you have to pay again for the pharmacy fee per drug. So there are lots of issues that have not been ironed out. So, and that's a bit of a worry for a lot of people. Right now, you still can get it. So at the end of the day, most GPs will say, look, you're out my budget, I'm not going to refer you forward, I'm not going to see you, or I'm going to delay seeing you, or I'm going to give you maybe less than optimum treatment, unless there are better audits. And if you think about audits in this country, it's non-existent at this point in time. If you fall sick, can you go to most pharmacies and buy whatever you want? You can. And we have been complaining about this, saying that that's not the proper way to do it. But the government says, oh, it's not happening, you're not complaining enough. You send the public health officer over, they just pay them a few dollars and they come away and say nothing is solved. It's very simple. So that's why you find very few of the pharmacies, the community pharmacies, they're blatantly selling medicines which your patients will take for a long time without any review, because they can. So this is what we have a problem with, about that accountability that's still not there. So when we talk about this social health insurance, a lot of people are very worried. It's going to be like a GST all over again. I think for most of us, and I totally agree with Kumar, GST is what we call a regressive tax. For the poor people there, you put whatever percentage on every little goods that you need to buy. It's a huge chunk, For example, if I were to buy rice, okay, and it will be taxed, up to say 6% now, okay, maybe just say it's 5%. I have to pay that 5%. But for me, that rice, because of my earning power and my disposable income, say I'm earning, say, 1,000 ringgit, every time it's a 5%, it eats into my, my ability to be able to spend my money as I would like to. What you call a disposable income. If I'm earning 20,000, that amount is not so much, because if I don't spend, I won't get. But when it comes to healthcare, you are having this GST-like poll tax. Whether you use it or not, everybody's going to get it. It's true, the richer will pay more. But at the end of the day, who's going to feel the pinch more will be the man in the street, who's that 40 or 60% in our Malaysian population. And that's why, although all the economies in the world will tell you that the GST is the way to go forward because all the countries have it, because that's the widest way in which to get tax, actually. But it is not the best for those with low income. And that's the reality in this country. Our low income is actually too big a segment in this country. So I think that's why the government owes it to the population to take care of these people and let those who can afford it look after themselves first for the time being, and work towards a more equitable or narrowing of the so-called Gini index that we are talking about. It's just too wide. Do you know our Gini index is the same as the United States? about 47, 46, which is very high. If it's 25, Sweden is 25, so it's very low.
What's the Gini index?
The Gini index is the highest, 10% versus the poorest 10%, the gap.
Income inequality.
Yep.
Yeah.
All right, income inequality. Okay, so you actually can work out. I think you can work either in quintiles or tertiles or whatever, but you still can work it out. Okay, so I think these are actually important ones. If you want, there are a few indexes that are there. So I think instead of this SHI at this point in time, we should forget about it and think of asking the government to come up with more money from our public purse. You know, I said cannibalize from the military. We don't need, inflated APCs. Incidentally, you're talking about the APC, which is the Armored Personnel Carrier, which is one of the lowest, of course, it's an armored thing, which costs about 30 million ringgit, right? The 10 million you're talking about is a US M1 Abrams tank, which is a much bigger machine. So can you imagine what we are getting at this point in time? Inflated things from everything else. So if you can actually cannibalize a couple of percent of the GDP from there, or even from the Port Klang fiasco, 12 point what billion dollars. Why do we agree to pay for that? Just take out, roughly our economy is around 600 billion per year. So we are talking about 2%, it's just another 1.23 billion. So I think we can do a lot more. 12 billion, sorry. I was just working out with the minister at one point, just playing some mind games. I said if you give 30 billion to the public sector, which is almost double, I think they can do a lot. Of course, they can also do a lot of nonsense and mischief, but at least some money will filter down, hopefully. So this is their projection as to where it's going to go. Okay, if you go to OneCare, they believe that the SHI is already factored in. It's going to be a big chunk of that. Okay, and the SHI is in the private sector. So in other words, almost all of it is there, and then the out-of-pocket is like almost disappeared, which doesn't make sense. It's not going to disappear. Even when I projected it with some economists about doubling our government taxation right now, the out-of-pocket will only drop to around 27, 28%. So I think it's not so simple. I'm not trying to make it simple, but what I'm trying to tell you is that it's a very complex thing. It's just that at this point in time, we shouldn't be aiming for something so grand right now, and it may actually break down. And the second thing, which I concur with Kumar, is that really there's just too many corrupt practices in this country that we cannot control, and that we worry that most of the money is just going to go elsewhere rather than to the actual, use that it's designed for. And I think this is why we are quite upset about it. I think we'll stop there and maybe take some questions and comments. I think that's probably better. Okay, thank you very much.